The mission of Community Support Services is to help the individuals we see maintain a healthy mind and body while supporting them where they live and work in the community. The mission is so important for the organization simply because for the longest time behavioral health wasn't really considered important. And as an organization, we realized a long time ago that individuals with severe and persistent mental illness died 25 years earlier than most folks. So we felt like it was important for us to take on that mission. And as we've morphed as an organization, we've added primary care to that. We did that approximately 15 years ago with a grant from the PEGS Foundation to do that. So now we have fully integrated healthcare.
The clients we deal with are much more likely to be on disability, much less likely to be able to work, have issues with housing, a lot of other things. Homeless Outreach Center we've had, I think, for almost 6 years now at this location. We've got a day room so clients can do personal hygienes. We have 4 commercial washers and dryers that are running constantly. We have coffee machine, free coffee for them. We have phones. We have individual shower stalls. We have 4 different ones so people can do their hygiene privately with a lock so their stuff doesn't disappear. That's what's hard. There's not many places to do laundry, we get showers. That gets them in the door. And then ideally we get them linked with case management. We can work with any needs that they have. I've got an amazing staff, wide variety of backgrounds, addiction, mental health, several with lived experience. They're really, really knowledgeable at taking care of any problems they have, whether it's mental health or housing or substance abuse. No one chooses that for themselves, and the same thing with addiction. I think people kind of get in their head that certain people are worthy of help and other people aren't. Lived experience, either with homelessness or addiction or mental health, is huge on my team. Just it gives them a way to connect with people in ways that other people can't.
We have services, a comprehensive array of services to help folks with mental health issues. And support, which is the middle of our company's name, support is the key to all of that. And support can be shown through the psychiatric services, supported employment, and so forth. We do a vocational profile right at the onset to really get to know the client and what they want to do, what their work history is, what their hobbies are, because that'll give us an idea of a direction for the client. And then once the client has a chosen employment goal, then we can help them with mock interviewing. We can help them get interview clothes if they need interview clothes. Sometimes they need to learn how to ride the bus. Sometimes they need help with buying IDs or getting a social security card. So all those services are important to helping a client get a job. Working reduces symptoms of mental illness. That has been proven. And increased social networking, because a lot of people that have a mental illness can be isolated just due to the nature of the illness, and getting them into the workplace and socializing is extremely important.
We don't have successes for every single client. Unfortunately, that's just the nature of some of the individuals we see, but we do have a lot of successes with people that have had long-term mental health illnesses, and we've been able to get those folks to live their best possible life. And oftentimes you'll hear people talking to our nurses, talking to our docs, talking to the case managers, and I'll hear them say, "You guys saved my life. If it hadn't been for you guys, I don't know where I'd be." So those are the things that make me energized when I come in the morning, realizing that we're actually having an impact on people's lives and that they're able to live the best possible life they can live, primarily due to what we've done for them at CSS.